Welcome to this second of a series of conversations with experts about hepatitis B, in which we answer important questions for both people at risk of infection and for healthcare providers. In this episode of Public Health Matters, we discuss in more detail what populations are most at risk for infection and what resources are available to help people with low or no income, and recent immigrants. Public Health Matters, brought to you by the Illinois Public Health Association. What are those areas that have high hepatitis B prevalence?
So the areas that have highest hepatitis B prevalence are the African region, the Asian and Pacific regions. And so this is why we have to have these conversations, because not many people have this knowledge, right? Not many people know which areas have high prevalence of hepatitis B. So, and with globalization, people travel back and forth from high prevalent regions without really putting into consideration that maybe they might have somehow been exposed to the virus. So having these conversations, having a podcast like this one, and just providing outreach and providing the resources to the community members is really critical in addressing this issue. So I mentioned that Africa, Asia, the Pacific Islanders, and Pacific Island, yeah, those are the three main areas where hepatitis B is highly prevalent. And it can be so because either maybe hepatitis B education and outreach is either non-existent or it's existent and people just don't know how to utilize the information they might have. And also you find that maybe testing sites are not very well known. Like if this healthcare system is providing Hep B services, you might find that maybe it's just one location, maybe in an entire region, right? And not many people might have that sort of information as to what they need to do when they have that information.
It sounds to me like if a person is going to travel from an area of low prevalence of hepatitis B to an area of high prevalence, number one, they need to know that.
Yes.
Number two, they need to go to the public health department or their physician and have a conversation about what sorts of vaccines should I have before I travel. And those areas, again, you talked about the Western Pacific region, the African region, but also the Eastern Mediterranean region, the Southeast Asia region, the European region, and it's less prevalent in the Americas, but it's even in the Americas.
Yeah.
There's a certain degree of prevalence of the hepatitis B virus.
Yeah. In addition to that, as I mentioned earlier, with globalization and traveling to and fro, we have a huge immigrant population from the regions that were mentioned, right? And so
that's a good point, because we're facing an increasing incidence of displaced populations.
Exactly.
Refugees.
Exactly. Yes.
And of course, countries like ours, we want to do our part to rescue people
and welcome everybody
from sometimes desperate situations.
Exactly. exactly. So, and you notice that when people are traveling, for example, like refugees, it's very difficult for them. And I don't think going to get the hepatitis B vaccine is on top of their list, you know? So, for example, when I was immigrating coming here, I had to go through all these processes, making sure that I was vaccinated for yellow fever. Hepatitis B was one of the things that I had to do. I had to get meningitis vaccination. I had to get all sorts of vaccinations because I was traveling at the time when there was no conflict. Life was just, normal day-to-day life, right? But you can imagine in a case of somebody who is fleeing a region because of either war or persecution or just some natural disasters. Going to get these vaccines is not on their list, because they are fleeing. So when they arrive in the United States,
there has to be a public health response.
Exactly.
Because they're not going to be even thinking about many of these things.
Exactly.
So it's important for public health professionals and those that are working with refugee and similar types of efforts that they understand that as people come into the country from these regions, these responses are just pretty much the same as if someone was traveling to those regions.
Exactly.
And therefore, again, this is preventable and manageable.
Manageable, yes.
If
only if
recognized and dealt with appropriately by trained and qualified medical professionals.
Exactly.
And public health professionals.
Exactly. And that's one of the reasons why we are having this conversation, so that we can spread awareness, so that we can at least fill in the gaps. We do realize that what we are doing today might not be enough to eradicate the problem, but at least it's a starting point.
Well, let's talk about this idea of eradicating the problem where it's most prevalent. Why are rates of hepatitis testing and vaccinations so low in these areas where it's most prevalent, those areas of the country, of the world?
Yeah. I can speak highly of the area where I come from, right? So you find that, as I mentioned earlier, there is lack of awareness about hepatitis B. The medical profession might know what hepatitis B is, but that information is not passed on to the general population. If I were to stage on a street and ask people just randomly, hey, do you know what hepatitis B is? Probably the answer would be, what are you talking about, So lack of awareness, yes, is one major problem that I have noted back where I come from. Even here, not many people know what hepatitis B is, So again, having these conversations, again, talking about this issue, again, distributing resources so that people might know what this disease is, because as we already know, it's highly preventable with preventative measures like vaccines, okay? And then the other issue might be accessibility. So what I mean by accessibility issues, you might find that these vaccines are not readily available. So when they are available, they are very expensive.
And you're talking about in these countries where the virus is most prevalent.
Yes. So accessibility issues, if the vaccine is there free of charge, not many people know that it's there free of charge, right? And if the vaccine is there, and you find that people live like 90 miles away from the nearest healthcare center or nearest healthcare provider, then it becomes an issue of how to get to the place where they can access the hepatitis B vaccines, right? So you find that in most cases, people will just do traditional medication, like, oh, we've lived with this problem for so long. Our ancestors taught us that we can eradicate it by doing A, B, C, D, E. But it's that A, B, C, D, E is only treating what you are seeing outside and not what is happening inside. So accessibility is really a huge issue in those areas. But again, I would attribute that it's also an issue here, When I started working on this project, I did a little bit of research to find out, like, if I needed to get my Hep B vaccine, where would I go? I asked my PCP, and my PCP told me that
what is PCP?
Primary care physician. I asked them, and they were like, well, the easiest way you can get it is either contacting the health department. And in most cases, not many of us know how to contact the health department.
Well, let's talk about that.
Yes.
Let's suppose that there are people who are listening to this conversation, and they're saying, well, I don't have insurance.
Exactly.
And therefore, I don't have a primary care physician
Exactly.
that I've established a relationship with.
Exactly.
And this is all wonderful information, but how would I get that help?
So, like here in the state of Illinois, the county health departments should be able to provide the resources. However, those resources are not for free. So if one is seeking Hep B vaccines, they might have to pay something out of pocket, because Hep B vaccines are not yet on the recommended list of vaccines that people should receive.
So this is a public health issue.
Yes, an issue of accessibility.
Because if public health facilities are available, and yet if people go there, they are unable to afford the vaccine or other medications, and we don't have then our public health system has a problem.
Yes.
That needs to be dealt with.
Mm-hmm. So I know of Planned Parenthood. I know that they do provide Hep B vaccines on a rolling scale. But even if it's a rolling scale and income-based, you still have to pay something, right? I haven't yet come across a scenario where somebody has received the Hep B vaccine $0. They at least have to pay something,
Well, here's something, though, that I think it's important for people to understand who are thinking, you've just convinced me I need to go receive some medical help. I need to at least be tested. But now you're telling me that I may have to face some sort of cost. Well, you don't incur the cost without making a choice to incur the cost.
Exactly.
So that's not a reason that people should avoid going to the public health department.
Exactly. Go there, start this conversation with them. They might have resources to help you.
And maybe by the time people hear this, things will have changed.
Yes, because as we know recently, the CDC passed a recommendation that's going to include individuals ranging in age from 18 to 59. So the Hep B vaccine is going to be among the recommended vaccines that if somebody has health insurance, they can receive it for $0. If somebody doesn't have health insurance, visit your local federally qualified health center, FQHCs, because in most cases they have probably some grants that they might use to help you. So the most important thing is don't be afraid because you've heard that you'd have to pay something. The most important thing is go there, have a conversation with them, and hear what they have to tell you about how they can assist you with getting the Hep B vaccine.
And even if the public health department is not in a position to provide that assistance, there may be other organizations
Exactly.
or other people
Exactly.
who are willing to assist.
Exactly.
But this is important for not just for people who may be at risk for hepatitis B.
Exactly.
This is important for policymakers to understand that if we are going to have an adequate and intelligent and effective public health response to the hepatitis B problem, then that includes making these preventative measures available
Yes.
to
readily
those who are
available.
most at risk especially, but to anyone else who may be traveling or something of that sort.
Mm-hmm.
And the management measures that you've been talking about,
Yes.
having those available at no or low cost so that people can afford them. Because if they can't afford them, then they might as well be 100 miles away and inaccessible.
Exactly.
And that's not what anybody wants.
Yeah.
So maybe things need to change.
Yeah. But I believe they can only change if we continue having these sorts of conversations, right? You bring the problem to light so that people are made aware of. And once people are made aware of, it's very easy for people to start asking questions, or they might start doing more research on their own to find out how they can get whatever assistance they might need. If they need a vaccine, if they need testing, if they need to see a specialist, and all of that stuff. So the beginning is having these conversations and disseminating the information so that everybody is well equipped with the information that's needed to deal with the issue at hand.
Awareness, education,
outreach.
And then, outreach, and then prevention.
Exactly.
And managing
Management.
infection.
Yes.
If people obtain the proper medical or public health assistance that they need.
Exactly.
And then the rest is up to us.
Yeah.
As a society to make that sort of response to infection available to the people who need it.
Yes. And we always say that prevention is always better than cure, because prevention, it might seem expensive to get the vaccines, right? But what if in a scenario where somebody didn't get the vaccine because it was so expensive for them, but then they end up having Hep B and they end up having to deal with all the costs that will come after that, which is cheaper? Getting the vaccine?
The vaccine is a bargain.
Exactly, right?
By any measure.
Exactly, because it will prevent one from having to look for other resources. It will prevent one from not having to deal with the effects of having liver cancer, because when you have liver cancer, your quality of life decreases, So preventative is always way cheaper than curative. So again, it just goes back to awareness.
Awareness on the part of people who are at risk.
Exactly.
But also awareness on the part of policymakers. And public health professionals.
Yes. So I think intensifying our outreach efforts, we need to be having these conversations. We really, really need to intensify on providing education and resources so that people are well informed. Encouraging the uptake of the vaccines. The vaccines are I understand they are not 100% there, but they are like 95%, 97% effective. So the chances of...
That is very high effectiveness.
Oh, yeah.
A very high effectiveness rate
Yes.
for a vaccine.
Yes, and with minimal side effects. So...
That's good news.
Yeah, it is.
If it's available.
Exactly.
And if people seek it.
Exactly.
Well, Monday, thank you very much for this important conversation. And for those that are listening, thank you for listening to this program, and thanks to the Illinois Public Health Association for producing it and making it possible. This will be part of a series of these discussions, and we hope that people listen to all of the series.
Thank you, David. And if people have more questions, just visit ipha.com and you will find all the contact information there. So thank you so much, David. This has really been a wonderful opportunity.
Thank you for joining us for this second of a series of conversations with experts about hepatitis B. Our next episode will continue this conversation and answer further questions about hepatitis B. So, please follow this program for those and other conversations with experts about public health matters. And please help spread the word by sharing links to this program on social media or on your own websites. Public Health Matters, brought to you by the Illinois Public Health Association.